What part of I'm busy don't you understand?
Excuse me, an urgent package has arrived.
Urgent? Who's it from?
You. From 20 years ago.
Thank you. What? Surprised? You probably don't even remember. If you're watching this, it means that 20 years have passed. I'm hoping our hairline isn't receding and that we don't have a large gut. As I know you, or rather as I know myself, we may have forgotten quite a few things we learned during this summer. So, I've decided to record this video to remind you of them. Remember the time when we were travelers, not tourists? When we were drawn by curiosity, not by a book. When we didn't need to make plans to have a good night. You remember. If you're happy, turn this video off. Ah, I see you're still there. The future. Did we marry her? No. Did you take my earring off? Well, after all, you are old enough. Remember, we always had time to make friends. And to learn. To learn that there was a time when the whole world said it can't be done. And the hopes of a country demonstrated that the world was wrong. And above all, remember that life is a succession of events, and that it all depends on how we live them. Wherever you are in 20 years' time, or rather, wherever we are in 20 years' time, remember when we came to Peru. Darling.
You'll be home late, won't you?
Have you ever been to Peru? Whatever you need is now in Peru.
La costa, unida la costa, unida la sierra, unida la selva contigo, Perú. Unido el trabajo, unido el deporte, unidos el norte, el centro y el sur. A triunfar, peruanos, que somos hermanos, que se haga victoria nuestra gratitud. Te daré la vida y cuando yo muera, me uniré en la tierra contigo, Perú. Te daré la vida y cuando yo muera, me uniré en la tierra contigo, Perú.
Welcome once again to this third day of this Inka Project Fair. Good morning, good afternoon, and good evening to each Rotarian around the world. We want to remind you that our fair will be held from September the 18th to the 24th between 12:30 and 2 p.m. Each day of the fair is dedicated to one focus area. The projects will be presented on the day that corresponds to each focus area. And we also have the possibility of virtual tourism in some of the regions of our District 4455. The fair will be in English, and if you need the English-Spanish interpretation service, you can press the button found in the bar of your Zoom screen. Bienvenidos una vez más a este tercer día de la Inka Project Fair. Buenos días, buenas tardes y buenas noches con cada rotario alrededor del mundo. Queremos hacer recuerdo que nuestra feria se realizará del 18 al 24 de septiembre, entre las 12:30 y las 2 de la tarde. Cada día de la feria está dedicada a un área de interés. Los proyectos serán presentados en el día que corresponde también a su área de interés y tendremos la posibilidad de hacer turismo virtual en alguna de las regiones del Distrito 4455. La feria será en inglés. Y en caso que deseen el servicio de interpretación inglés-español, podrán presionar el botón que se encuentra en la barra inferior de la pantalla de Zoom. In Cusco, every corner tells a story, and every story is captivating and inviting. Imagine walking through those streets. In these streets, time seems to have stopped. Every corner offers a piece of history, and the stones remain alive because they have survived intact through time. Join us on this magical trip to Cusco. En Cusco, cada rincón cuenta con una historia y cada historia es cautivadora y acogedora. Imagínese caminando por las calles, en estas calles del tiempo, parece que se ha detenido y cada rincón ofrece un trozo de historia. Y las piedras siguen vivas porque han sobrevivido intactas al paso del tiempo. Acompáñenos a realizar este mágico viaje virtual a Cusco. This day is dedicated to the focus area that supports mothers and babies. And it's a pleasure once again to introduce Nericy Castro, Support for Mothers and Babies Manager. Este día está dedicado al área de interés de salud materno-infantil. Y es un placer presentar una vez más a Nericy Castro, gerente del área de interés de salud materno-infantil.
Hello, everyone, and thanks for having me. Thanks for having me here to present on maternal and child health. My name is Dr. Nerisi Castro, and I am the Area of Focus Manager for Maternal and Child Health at Rotary International. Maternal and child health is one of Rotary's 7 areas of focus. The areas of focus at Rotary are informed by and serve 9 of the 17 United Nations Sustainable Development Goals. For Rotary year 2014-2021, the total Rotary Foundation funding per maternal and child health for global grants has been $58 million. So Rotary has invested $58 million over the course of 2014 through 2021 in 690 grants that support the maternal and child health area of focus, which in turn support the Sustainable Development Goal number 3, which is good health and well-being. So Rotary's area of focus focuses on improving maternal health and reducing mortality and morbidity for children under the age of 5. We do this by reducing the neonatal and newborn mortality rate, reducing the mortality and morbidity rate for children under 5, and also reducing the mortality and morbidity rate for mothers. This also goes into improving access to essential medical services, trained community health workers, and trained healthcare providers. And we also fund graduate scholarships for career-minded professionals as it relates to maternal and child health. So if we look at the funding for maternal and child health by the Rotary Foundation, it had been on a steady increase through 2019. And then it took a slight dip and a downward trend in 2020 and also further in 2021. This is during the COVID-19 pandemic, as a lot of areas of focus, a lot of communities have invested their funding and monies into supporting the COVID-19 pandemic. We did not see such a huge decrease in maternal and child health funding as was seen in other areas of focus, but this is largely due to the fact that maternal and child health also supports disease prevention and treatment, but in a subset of the population. By project type, the majority of funding for maternal and child health has gone into medical equipment purchases, followed by maternal prenatal care, labor and delivery and antenatal services, midwifery and other maternal and child health care worker training has rounded off the top 3 project types for maternal and child health. Broken down by region, the greatest share of funding has gone into the Africa region. Sub-Saharan Africa has experienced or has some of the highest maternal mortality rates in the world. And as a result of that, Rotarians have chosen to invest and develop projects in this arena in Africa. Second and third regions with monies invested have been Asia when we combine this with India, followed by the Americas. And by project type, the majority of funding for maternal and child health by way of almost $48 million has been in humanitarian type projects. And this is followed by humanitarian combined with vocational technical team type projects. So looking into child health. We have an estimated 5.2 million children under the age of 5 who die mostly from preventable and treatable causes on an annual basis. And we're looking into preterm birth, birth asphyxia, trauma, and congenital anomalies, as well as infectious diseases such as pneumonia, diarrhea, and malaria are all leading causes of these deaths. We have sub-Saharan Africa and Central and Southern Asia, which account for more than 80% of these deaths in children under the age of 5. The United Nations Sustainable Development Goals include specific targets of reducing preventable deaths of newborns and children under 5 by 2030. So it's an area where we see a lot of Rotarians rallying around in developing projects that will help support alleviate some of these burdens. Reproductive health. We're looking at 214 million women across the world who have unmet needs for modern contraception. And as we know, contraception offers a wide variety or a wide range of benefits, from economic development to education and barrier methods, which also prevent the transmission of HIV and other sexually transmitted infections. And this is all per the World Health Organization as it relates to reproductive health. Looking at antenatal care and childbirth, we have a comparison of what it's like in developing countries versus in underdeveloped countries, in developing countries versus developed countries. In developing countries, 1 in 45 women is at risk of dying from maternal death. And when you compare this to 1 in 5,400 women in developed countries, the difference is alarming. In 2017, 810 women died every day around the world from preventable and treatable complications during and following pregnancy and childbirth. This includes severe bleeding from infections, high blood pressure during pregnancy, and complications from delivery. And 94% of the aforementioned deaths occur in developing countries, with 80% of these deaths that could be prevented with adequate access to reproductive health services, antenatal care in pregnancy, and skilled care during childbirth and postpartum care. So how can Rotarians take action? We can develop or support programs that provide immunizations against vaccine preventable diseases for children under 5, promote good nutrition, especially for women of childbearing age, pregnant and postpartum women, by including encouraging exclusive breastfeeding when appropriate for the first 6 months of life. We want to eliminate mother-to-child HIV transmission by increasing access to testing and antiretroviral drugs. We want to support projects that provide access to antenatal care in underserved communities, educate women and families on the need for seeking antenatal health care early in the first trimester is key for good outcomes. We want to provide information about and access to contraceptives. So when we look at just filling the unmet need for contraceptive, could reduce the number of maternal deaths by nearly 1/3. So these are all good ways and good ways that can Rotarians can support their communities by developing these types of projects and supporting projects that support these causes. Tips for success. We want to consult Rotary members who are trained in maternal and newborn health care, such as midwives, obstetricians, and gynecologists. Partner with local, regional, district, and national health systems to increase access to equipment, facilities, and the latest maternal and child health care programs. Partnership, very important. Partner with community-based organizations that have expertise in maternal and child health and ensure sustainability by empowering the local community to take ownership of the healthcare training programs for local healthcare workers, including at the community level. I mentioned earlier, consult with Rotary members. Rotary has a wide list of action groups, Rotarian action groups, and cadre members that are skilled in medicine and public health and maternal and child health and community health that can support and provide advice, expertise, technical review to project development, concept review that can go in supporting these types of projects. And I urge you and encourage you to contact local cadre members and Rotarian action groups to support in these causes. When you look at access to healthcare services, less than half of the world's population is covered by essential health services. Major disruptions in health, such as the COVID-19 pandemic that has affected us all, natural disasters and high complex situations could reverse decades of improvement and in a lot of the disease processes. And in maternal and child health, strides that we've made in maternal and child health can be completely reversed or decrease. They continue to plateau due to these major disruptions, which reduces or decreases our access to healthcare professional facilities and other maternal and child healthcare services that are critical for healthy pregnancies, deliveries, and just a healthy life for women and children. Over 40% of all countries have fewer than 10 medical doctors per 10,000 people. And we're looking at over 55% of countries have fewer than 40 nursing and midwifery personnel per 10,000 people. This results in deliveries that are unattended by trained personnel and has been a major factor in healthy, good outcomes and healthy deliveries. So we're going to need an additional 18 million healthcare workers, primarily in these developing countries that are affected so much to achieve universal health care coverage by the year 2030, as set forth in the United Nations Sustainable Development Goals. So how can Rotarians take action? We want to support continuing education and training for health workers through scholarship stipends and public recognition. We want to improve the quality of existing services by taking a people-centered approach to health systems and infrastructure. And we want to support projects that expand access, and this is antenatal care, this is postnatal care, this is sexual and reproductive health care, all of these services that are needed. We want to expand access to and support directly to vulnerable and underserved communities. We want to be providing these services when and where the communities need them. And that is very, very important as we begin to frame our maternal and child health projects. Be cognizant of cultural barriers, be cognizant of who we're serving, where we're serving them, is it where and when we need them. And this takes me to one of the last slides where we focus on the community. We cannot serve the communities without consulting communities. We want to gather perspectives from a broad cross-section of the community. We want to be inclusive of gender diversity. We want to be inclusive of age, of the age disparities, and we want to include community members that have medical, public health, maternal and child health insight into the proposed issues that to be resolved and in the anticipated solutions. So we want to allow the community members to identify what needs they see are most critical, allow them to contribute to the proposed project, and work with community members to identify long-term goals and expected project outcomes. And this allows the community to be a part of the project from concept inception all the way through implementation. Communities know how to take care of communities, and we want to involve them as much as possible when developing maternal and child health projects. Well, thank you very much for having me. I've included in my final slide here my contact information. I can be reached via email or Zoom, and to review any project concept ideas, brainstorm on proposed solutions, and just to have overall discussions as it relates to maternal and child health, so that we can better develop and implement maternal and child health projects for the betterment of the community. Thank you very much.
Now we come to the most important moment of this Inka Project Fair, which is the presentation of our district projects. Ahora llegamos al momento más importante de esta feria, que es la presentación de nuestros proyectos del distrito. So we start with project number 1, Rotary Club Monterrico Surco, Healthy Milk for Newborns. Ahora empezamos con el Rotary Club Monterrico Surco, leche saludable para recién nacidos.
Hello, greetings from Rotary Club Monterrico Surco in Lima, Peru. We are now here in the Inka Project Fair, and we are going to share one of our projects. Our project is called Safe Milk for Newborns. This project will be in the National Maternal Perinatal Institute. You know that this institute has a human milk bank where breast milk is collected, processed, and distributed in heart-resistant glass jars. After use, these jars are manually washed, dried, and sterilized. This project proposes the purchase of a milk glass jars washer sterilizer in order to guarantee that the 1,436 daily jars with milk are provided to babies in good food safety conditions. The Human Milk Bank service is provided to preterm or lactating newborns whose mothers have contagious diseases or lack of milk. What is the general objective? To provide human milk to newborns and babies cared in the institute in good safety conditions. What are the specific objectives? To reduce human contact when handling milk to avoid contamination, and to assign technical personnel to other tasks that improve the quality of care for pregnant women and babies. What do we do in the bank? We have the fractionation, the distribution, the processing, and the pasteurization. To give these glass jars that are used to autologous milk extraction for your hospitalized child in the extraction room, and to extraction and administration of breast milk in hospital rooms. The National Maternal Perinatal Institute is located in the center of metropolitan Lima, and its area of direct influence includes the city of Lima. But as it is a reference hospital center, its scope is national. An average of 52 births are attended daily, of which 35 to 38 daily babies are attended in the intensive care unit due to problems with pregnant mothers or babies, and are users of the human milk bank. This project is in the area of focus maternal and child health. And the sustainability of the project is clear because the Institute has competent medical and technical personnel in the proper handling of the equipment. The Institute has the conditions of temperature, electricity, water pressure, and the place where the equipment will be located is ideal for conserving the equipment over time. And the Institute will assign a budget for the preventive and corrective maintenance of the equipment. The project budget is of $290,000 soles, that is $72,500. Thank you, and we hope that this project can be of your interest. Thank you.
Thanks, Rotary Club Monterrico Surco. Gracias, Rotary Club Monterrico Surco. Now we come with project number 2, Rotary Club San Miguel, maternal ward equipment for a health center in San Miguel. Rotary Club San Miguel, equipamiento de maternidad para un centro de salud en San Miguel.
En el Centro de Salud San Miguel Manuel Bertolini Jordán integramos excelencia médica con un cálido servicio humano. Anualmente atendemos a más de 250 mujeres embarazadas desde los controles previos como control prenatal, psicología dental, nutrición y psicoprofilaxis, brindándoles atención de calidad de trato muy humano.
Aquí la atención es de calidad con calidez, como lo norma la institución.
Tenemos ya como norma, como perfil de obstetras, es acercarnos mucho a la mujer embarazada.
Desde el primer momento en que comencé a atenderme con la obstetra, fue una atención extraordinaria.
Yo hice caso a todo lo que me decía el doctor, la doctora, todo lo que ellos me decían, le hacía caso, porque sí, ellos son los que saben.
Yo creo que ellas se identifican mucho con nosotras, ¿no? Por el trato que les damos, y muchas de ellas pues quisieran terminar todo el proceso con nosotras.
Por esta razón, deseamos alcanzar la posibilidad de brindar un servicio integral en beneficio a nuestras usuarias al contar con ambientes completos y equipados en todas las áreas en las que debe atenderse.
Nosotros no tenemos acá una sala de partos funcional. Si bien es cierto, hay una infraestructura que es preparada para una sala de parto, pero no está funcionando.
Bueno, lo ideal sería pues terminar todo el proceso acá con nuestras gestantes, sobre todo las de bajo riesgo, ¿no? Que no tengan que trasladarse a otros lugares.
Y ya con eso culminaríamos con el trabajo realizado durante los meses de control y terminaríamos con el producto ya propiamente dicho, que sería el bebé o el recién nacido.
El centro obstétrico, la gestante va a ingresar por esta puerta para ser evaluada y seguir todo el proceso. En el lado derecho nosotros tenemos la primera parte que se llama la sala de dilatación. Le hacen el seguimiento, la controlan y en el momento que ya esté para dar a luz pasará a la sala de partos. Nosotros estamos en capacidad de hacer una cesárea. Esta sala de operaciones se termina el proceso quirúrgico y el paciente, la gestante, sale hacia hospitalización tan igual como el niño. En esta hospitalización, la paciente, 1, 2, 3 que estén, van a pasar más o menos 24 horas. Esas 24 horas van a poder acá tener la visita de su familiar, el estar con la familia acá al costado hasta que el médico, la obstetra, le da el pase a que esté de alta y pueda ir a su casa.
Las áreas que nos hacen falta y cuyos ambientes ya tenemos disponibles están listos para entrar en funcionamiento cuando sean debidamente equipados. De esta manera, el trabajo que realizamos será integral a favor de nuestra usuaria, ya que evitará trasladarse a otra institución y podrá obtener un servicio completo.
Thanks, Rotary Club San Miguel. Gracias, Rotary Club San Miguel. So now we come with project number 3, and we have Rotary Club Inka Sur. And this project is called Neonatal Transportation. Ahora venimos con el proyecto número 3 del Rotary Club Inka Sur. El proyecto se llama Transporte Neonatal.
Rotary Ikasur presents in this Inka Fair the neonatal transportation project, whose cost is $37,000 and is framed in the area of interest of Rotary maternal child health, will be implemented in the Hospital Santa Maria de Socorro in the province of Ica and department of Ica, which is located on the south central coast of Peru, facing the Pacific Ocean, and has a population 7,170 citizens. Over the years, it has suffered several disasters such as floods and earthquakes, such as the earthquake of August 15, 2007 of 7.8 grades, in which many lives were lost, and the strong earthquake destroyed houses, roads, church, and hospital. The Santa Maria Socorro Hospital suffered 60% damage to its infrastructure, and a new hospital had to be built, which became operational in 2012. Rotary projects are born in the community, and each community presents its own deficits and problems. Public hospitals in Peru in neonatology units present deficits in terms of ability of equipment for the care of premature newborns. In the year 2019, 100 babies died in Peru due to lack of incubators, and this problem can also be seen in the province of Ica, where the same years 25 premature babies died due to lack of adequate medical equipment. Santa Maria Socorro Hospital in Ica, 2,300 to 2,500 births are attended per year, of which 35% to 5% are premature, with 4 out of every 1,000 children dying in the first month. During the national health emergency due to the COVID-19 pandemic, the Santa Maria Socorro Hospital in Ica registered the birth of 592 babies. It was also reported that 52% deliveries were attended in the hospital. This newborns managed to recover. However, 3 newborns did not survive. Labor percent is birth before 37 weeks gestation and is the most important cause of prenatal morbidity and mortality. There are several factors associated with the presence of this event. In the neonatology unit at the Hospital Santa Maria Socorro, there are failing incubators and others that must be decommissioned because they have been in operation for up to 19 years and does not have any transport incubator to assist premature newborns. The neonatal transportation project will allow us to equip the pediatric area of Santa Maria Socorro Hospital in Ica with a neonatal transport incubator so necessary to provide better assisted transport of premature newborns to more complex centers for specialist treatment in order to reduce the perinatal morbidity rate in the department of Ica. Hospital health personnel will also be training in the use of the equipment, and fertilized women will be given talks on pregnancy, childbirth, and neonatal care. The cost of the project is the $37,000. The beneficiaries will be patients who attended the Hospital Santa Maria Socorro in the Department of Ica and in the extreme poverty areas of the Department of Ayacucho and Huancavelica. Children have the right to receive adequate attention for their needs, considering their weeks of gestation, their weight, and their particular characteristic. Together we save life. Would you like to know about our project, Neonatal Transport? Contact us, Alfredo Yola Garcia.
Thanks, Rotary Club Ica Sur. Gracias al Rotary Club Ica Sur. So now it's the turn for the project number 4. Rotary Club San Isidro, project called Pediatric Ambulance for Children's Hospital. Ahora es el turno del proyecto número 4 del Rotary Club San Isidro, denominado Ambulancia Pediátrica para un Hospital Infantil.
Rotary Club of San Isidro project, in coordination with a professional at National Children's Hospital, has identified an urgent need to provide with a pediatric ambulance to the health center. The National Children's Hospital is the oldest pediatric specialized center in the country, and its coverage is all our country, that is, attends specialized cases to children and neonates throughout Peru. According to 2016 census, our child population between 0 and 11 years was near 7 million children. The National Children's Hospital is in Lima, Peru capital. The pediatric ambulance project for the hospital is part of Rotary's strategic line at maternal and child health, consists in providing to the National Children's Hospital with a pediatric ambulance for emergency care. At this moment, the hospital does not have one appropriate for children. It needs to have a pediatric type, which is a medical equipment they do not have at this moment, and the requirement is urgently due to the high demand for medical transporting of children and neonatal in critical conditions, a serious situation due to COVID pandemic. This that is all rescue service and specialized medical care for children. The equipment is established according to standards from Health National Office and with international standard for the design of special vehicles, ISO 9001. This is a Renault Master Urban Ambulance. It costs $122,000. This mobile unit will allow to assist urgent medical problems, covering all rescue services, medical care, and transport for sick or injured children to medical center. This pediatric ambulance has the equipment to transport neonates and children. The hospital assumes the cost of operation and maintenance, and insert this one as a set of Health National Office, and introduce in their budget $60,000 for the above mentioned concepts.
Thanks, Rotary Club San Isidro. Gracias al Rotary Club San Isidro. Now it's the turn for project number 5. And it comes with Rotary Club Monte Rico Circle, Saving Newborn Lives. Y ahora es el turno del proyecto número 5, un proyecto del Club Rotario Monterrico Surco, salvar vidas de recién nacidos.
Hello, greetings from the Rotary Club Monterrico Surco from Lima, Peru. We are now in the Inka Project Fair in Peru, and we are going to present one of our projects. Our project is saving newborns' lives. And as you see, we are the members of the club in the Instituto Materno Perinatal from Peru. What is the idea of this project? We want the purchase of 10 multi-parameter monitors for the National Maternal Perinatal Institute, the largest maternity hospital in Peru and the third in Latin America and a reference center in the maternal perinatal field. The monitors are used to measure the following parameters of newborns: oxygen saturation pressure, heart rate, blood pressure, EKG, temperature, and CO2 partial pressure. The general objective of our project is to provide health services with quality, efficiency, and opportunity to the newborn. The specific objectives are to reduce newborn mortality rates and to reduce morbidity rates in newborns. When we talk about the beneficiary population, we want to say that the National Maternal Perinatal Institute is located in the center of metropolitan Lima, and its area of direct influence includes the city of Lima. But as it is a reference hospital center, its scope is national. The pregnant women who are cared at the Institute belong to the socio-economic levels D and E, and there are an average of 19,000 births per year. The average age of pregnant women is 25 years, and 19% are adolescents. This project is in the area of focus of maternal and child health. And the sustainability of the project is clear because the National Maternal Perinatal Institute has competent medical and technical personnel in the proper handling of the equipment. And the Institute will assign a budget for the maintenance of the equipment. The project budget is of $48,880. And these costs include taxes, insurance, transportation, installation, and training. Thank for your attention, and we are very, very happy to share with you our project. Thank you.
Thanks to Rotary Club Monterrico Surco. Gracias al Rotary Club Monterrico Surco. So now it's the turn for project number 6, Rotary Club Magdalena. And this project, it's called Your Love Is Made of Iron. Ahora es el turno del proyecto número 6. Con este proyecto está auspiciado, lo trae el Rotary Club Magdalena y se denomina Tu amor está hecho de hierro.
Rotary Club Magdalena would like to introduce our project, Your Love is Made of Iron, Decrease Anemia Levels. Our local liaison contact is Mrs. Carmen Ferrario Russo. The total funding is $33,610. This is our project description. Our goal is to decrease anemia levels, detect, monitor, and improve iron intake in children and pregnant women. According to Magdalena Maternal Child Health Center, 43.8% of children under 3 years old report low iron intake. Thus, it is vital to contribute to the diagnosis, nutritional assessment, control and recovery, monitoring, and treatment by discarding anemia. In order to achieve our purpose, we plan to 1. Acquire 6 portable hemoglobin meters plus accessories, 2 stadiometers, 2 baby scales, 2 personal scales plus accessories for diagnosis, control, recovery, and treatment of anemia in children and pregnant women. 2. Improve iron intake by providing food supplements such as galletas Nutri-H, antianémicas, and other food supplies. 3. Provide implements to 15 classes of milk committees, which are not receiving any support from the government since the pandemic started. The supplies include industrial stuff, pots, cooking supplies, tools, and storage. 4. Promote sustainability by purchasing 2 computers and 2 printers to help with the follow-up and control. Our main contributors are Municipality of Magdalena del Mar Social Service Department, Magdalena Maternal Child Health Center, and Comité del Vaso de Leche. The beneficiary population of Magdalena del Mar includes 1,850 people that include children, pregnant women, and people with disabilities that are under extreme poverty from sectors 1, 2, 7, and 8. With your help, the children, the vulnerable families, the families from sectors 1, 2, 7, and 8 that are under extreme poverty will benefit. And even the comedores populares that now look like this will change and improve, thanks to your generosity. Meet our team, Carmen Ferrario, Antonella Giudice, and Gabriela Carrillo. If you would like to find more about our project and the detailed budget, please follow the link. Rotary Club Magdalena would like to thank you.
Thanks to Rotary Club Magdalena. Gracias al Rotary Club Magdalena. So now comes project number 7 from the Rotary Club Arequipa Primavera. And it's called Implementation of the Rural Maternal House Chuquibamba. Y ahora es el turno del proyecto número 7. Lo trae el Rotary Club Arequipa Primavera, denominado Implementación de la Casa Maternal Rural Chuquibamba.
There are places in the world where pregnant women do not have the economic resources to pay for a birth in a medical center. There are still places in the world where social programs do not reach all pregnant women. There are also places with no health care centers. There are places where a pregnant woman must travel by trail or walk to be able to attend her delivery, and many times she has to spend several nights outside her community. Did you know that there are some places that concentrate all these characteristics at the same time? And do you know that the main cause of death of pregnant women in this place is the lack of professional and timely care before, during, and after childbirth? The rural district of Chuquibamba, cloistered in the Peruvian Andes, has a medical center in which we seek to improve the care capacity of pregnant women and implement the maternal home, a place where temporary accommodation will be given to pregnant women with limited resources. Women from faraway places with no service for their due attention. It will also serve to provide an alternative service to women, where the expectant mother is cared for and prepared, It is very important to improve safety and well-being to the expectant mother in order to prevent maternal and perinatal death. The Rotary Club Arequipa Primavera develops sustainable projects in healthcare for people with limited resources in high-ending areas from southern Peru. Places with difficult and remote access to a medical center, expensive costs involved in moving to another town, or the lack of awareness about healthcare. We have campaigned with Rotary clubs in Texas and Canada, as well as with international collaborating organizations such as the Starkey Foundation and Medical Ministry International, with whom we have been developing a global grant with the Rotary Foundation. Our commitment is solid with the improvement of living and health conditions for more people. Join us and let's make good things happen.
Thanks, Rotary Club Arequipa Primavera. Gracias al Rotary Club Arequipa Primavera. The little feet make the biggest footprints in our hearts. Thanks and enjoy this typical dance called Balicha from Cusco. Don't forget to join us tomorrow on the 4th day of this Inka Project Fair. We will show projects related to peace building and conflict prevention at noon time from Peru. Los pies más pequeños hacen las huellas más grandes en nuestros corazones. Gracias y disfruta de este baile típico cusqueño llamado balicha. No se olviden de mañana poder estar a la misma hora y en este mismo Zoom para ver el 4º día de nuestra feria llamada Inka Project Fair. Los esperamos. Estaremos tratando proyectos relacionados a lo que es el tema paz y prevención, resolución de conflictos, al mediodía, hora de Perú. Gracias.